I'm Mylan Huang. Welcome to Healthful Matters. There are so many health awareness events going on this month, and the nurses at Meredith Medical Center wants to raise awareness about type 2 diabetes in children. This week, I got the chance to interview an emergency room nurse who talked more about the education initiative to inform children about diabetes.
This year, we're going to be educating the community on the increased type 2 diabetes in the young population, specifically those usually under 18, focusing on teens, as diabetes is really growing in that population, and we're linking it to obesity in the young. As part of Emergency Nurses Week, we are trying to educate the young population because we're hoping that maybe we can help them from or prevent them from getting the type 2 diabetes if we educate them young, if we educate them on how to have a healthy lifestyle. And maybe if we can catch it early, they will mitigate not having diabetes. We're going to be doing a Just Teens event at the Valley Mall on October 19th from 4 to 9. We're going to be doing a spin wheel. We're going to be educating on not only the diabetes, but we're going to be educating on Don't Text and Drive and multiple other initiatives that the hospital is focusing on right now. The event at Valley Mall is just for teenagers. Instead of trying to include both adults and teenagers, we feel like maybe we can get more teenagers involved if the event is just for them.
Last year, 20 local organizations focused on empowering teens to be safe, healthy, and smart when faced with difficult decisions. Meredith's health representatives will also be at the event to answer any questions you may have. So remember to put this in your calendar and be informed.
If you're obese, you do have a higher chance of getting type 2 diabetes. Type 2 diabetes is where your pancreas doesn't produce as much insulin as it should. Therefore, it can be controlled with diet, it can be controlled with medications, but if you're obese, you have much more of a chance of getting that.
When you hear the word insulin, you may think of a drug taken by people who have diabetes. While this is true, what you may not know is that insulin is one of the many hormones created in the human body. Insulin is important to the body. It allows blood sugar, or glucose, to get into cells to provide them with energy. When you eat, your body breaks down food into glucose in your small intestine. This is your body's source of energy for everything it does, from working and thinking to exercising and healing. Glucose travels through your bloodstream, looking for individual cells that need energy. For glucose to get into the cells, it requires insulin. Insulin is the key that unlocks cells for glucose to enter and deliver energy. When insulin arrives, it signals the cell to activate glucose transporters. These transporters pull glucose through cell walls. When glucose moves into the cell, it delivers energy.
Some of the subtle symptoms that you can be looking for are increased thirst, increased hunger, just feeling really tired, weight loss, blurred vision. Everybody's symptoms are a little different. Each person's very unique, but those are some of the main symptoms. Type 2 diabetes can lead to heart disease, it can lead to increased cholesterol, it can lead to poor wound healing, and for our obese population, a lot of times that they try to control it with diet, with sending them to a diet program, controlling it with exercise, instead of putting them on medications right away. Type 2 diabetes, I wouldn't say it's reversible, but it's controllable. Like I said, it can be controlled with the diet, with exercise, and sometimes with medications. It just depends on each individual person's situation. Have a good diet plan, a good exercise plan. Sometimes you can help yourself get off the medicines for diabetes, and you can prevent having those long-term effects of heart disease. Pre-diabetics, again, back to the diet and the exercise. Those are going to be their two main things. Follow up with a dietitian, follow up with someone that can help them get a plan individualized for just them.
The following risk factors are associated with an increased risk of type 2 diabetes in children: being overweight, family history of diabetes, if you are a female, certain ethnic groups like American Indian, African American, Asian, or Hispanic Latino. The single greatest risk factor for type 2 diabetes in children is excess weight. In the United States, nearly 1 out of every 5 children is considered to be overweight. Once a child is overweight, chances are more than double that the child will develop diabetes. One or more of these factors may contribute to excess weight or obesity. Uneating healthy patterns, lack of physical activity, an inherited tendency, and rarely, but it does happen, a hormone problem or other medical condition.
It's the #1 cause of blindness in adults. It doubles the risk of heart attack and stroke. If trends continue, 1 in 3 children born today will face it in their lifetime. 1 in 4 people who have it don't know it yet, and 1 in 5 Americans are at high risk of developing it. Together, we can stop a disease that burdens and shortens life. Help us raise awareness, raise research funds, and raise hope at stopdiabetes.com.
In addition, as with adults, the risk of type 2 diabetes in children appears to be associated with excess abdominal weight. This obesity pattern increases the chance of insulin resistance and the risk of type 2 diabetes. The symptoms of type 2 diabetes in children develop slowly. Initially, there may be no symptoms. Registered nurse Beth Fields mentioned several symptoms of type 2 diabetes before, but here are some other symptoms to look out for. Unexplained weight loss, increased hunger or thirst, dry mouth, frequent urination, blurred vision, heavy breathing, slow healing of sores or cuts, itchy skin, and numbness or tingling in the hands or feet.
For diabetes, we do blood tests. They look at your overall blood glucose over a 3-month period, and then they do a physical exam on you.
I don't want to go blind from diabetes.
I don't want to lose a foot or a leg.
I don't want to have kidney failure, so I'm taking control. I'm controlling my diabetes.
It's making a huge difference.
I'm eating healthy and staying physically active.
I'm taking my medicine.
If I can do it, anyone can.
Control your diabetes for life. Call 1-800-438-5383.
If you are a teenager or know of a teenager, then take advantage of the wealth of information that will be available to you at the Just Teens event on Friday, October 19th from 4 to 8:30 p.m. at Valley Mall. And diabetes is a deadly disease affecting millions of people around the world every day. Talk to your doctor about what you could do to control diabetes. Thank you for joining me in this week's Healthful Matters.